Hi everybody, I'm here with Meera, and we're in Calgary, Alberta, Canada. And we connected over Twitter, and she sent me this tweet that was pretty interesting. She says, I'm a Christian, I'm an RN, that's registered nurse if you did not know, and I support the harm reduction model. So she's here speaking on her own. This is her, not where she works or where she worships or anything else. You. And so first off, why did you send me that tweet?
Well, I sent you the tweet because it's rare that Christians speak out in favor of harm reduction. But it's surprising to me that it's rare because harm reduction is just such an integral part of the Christian faith. Grace is just, that's what defines the Christian faith. So I thought that Christians have been getting such a bad rap for such a long time, and deservedly so. But it's refreshing to be a Christian voice on this.
I'm a Christian, and I support the harm reduction model. And maybe you can explain it more from the health care point of view. What is harm reduction? What is the clinical definition, if you would, of harm reduction?
So harm reduction is a philosophy of care for people who are actively using drugs or making decisions that other people might not see as good decisions. Decisions that are poor to their health, so actively engage in risk behaviors. And this philosophy of care means that it accepts that people will engage in risky behaviors sometimes, but that we don't want them to die.
Right.
Because we believe that that's a phase of their life. We have hope for them. And so we care for them in that time and try and minimize the damage they do to themselves.
Right. And how did this evolution come about?
The evolution for me?
For you.
For me personally. Okay.
Yes. Because I don't know any of church that really goes out and supports a needle exchange program or different harm reduction models, handing out condoms. You know what I mean?
Yeah, so there are some. So not to minimize it, there are definitely some churches that are involved with that. But
I know. Yeah.
Evangelical mainstream has not been up for this, and I think it's just a misunderstanding.
Right.
I think it's just a misunderstanding of what harm reduction really is about. So from myself, I went to Vancouver to attend Regent College and learn more about my faith and about Christianity. But I thought while I was there attending this Christian graduate school, I may as well go to where I think that God will be in Vancouver. So I called up the Downtown East Side's nurse recruitment line, and I said, hey, I'm going to apply for this job at this clinic in the Downtown East Side. And they said, great, when you apply for this, just know that the nurses are also cross-trained at Insight, the supervised injection site. And I said, okay, sure. And I hung up and I was like, oh, is this something I can really do? Can I hand an addict a needle? As a Christian, can I do that? As a nurse, can I find somebody a vein if I know that they're just going to shoot up into it? And so these were all the questions that I was struggling with. I started my first day there, and a guy was jugging, which is trying to shoot up into his neck. And he was Dopesick, so his hands were shaking. And I just watched him, and he was moving between his carotid artery and his jugular artery, and his jugular vein, and I just didn't know what was going on. I was so worried that he was going to miss, and that it's so dangerous to shoot up into your neck. So instinctively, I just yelled, stop, I can find you a vein in your arm. And after that moment had passed and he was finished, I realized, wait, was that unethical for me to say that to him? In the moment, I knew what I had to do was save his life. But there's freedom outside of that reality. So you don't have to face that reality. And in that freedom outside the reality, I was conflicted. I was like, should I have done that? Is that something, I could do? But more and more people came through, and as I saw these people, and some of them overdosed, and I would be able to bring them back from an overdose. And I just saw the difference that nurses and Portland hotel staff could make.
And they would have died.
In their lives. They
would have died. And
yeah,
the whole reason
absolutely.
it was started is because people were dying.
Yeah, and so the most recent research report, and published in the Lancet just showed that overdose deaths in the downtown east side decreased by 35% since
That's huge.
It's huge.
and people are getting sober. They're saying, I'm sick of it.
Yeah.
I need help. And
that comes through relationship.
Right.
So if you're going to be present with injection drug users, you build that relationship. Right. You can't just watch as they're sharing needles, right? In a Hep C rate of over 90% in that population. So being present necessitates action. It means like, don't share needles. If you're going to overdose, we're going to bring you back. So the concept of insight is simply being present as they inject. Right. And everything else just comes along with it.
You said something that was interesting, bringing it back to the Christian faith. Mm-hmm. You found grace there. You even said insight is grace because it's saving lives.
Yeah. Well, I think that as Christians understand faith and God, we believe that that God has grace for us. We believe that we all sin, and that regardless and despite that sin, God loves us. He loves us while we are still sinners.
Forgives the sin, but saves your life.
Yeah, but he cares for us. So even while we're in that sin, even before we've asked for repentance, he's there, he's present. And so if the church is going to be where God is, they need to be present as well. And I think all that the church needs to do is get into these places, be a presence, and then everything else comes from that. And then these questions that we have about harm reduction, giving out condoms and stuff, those aren't the questions we ask anymore. Instead, what we're asking are questions about, like, how can I be with you? How can we have a real relationship? What can you teach me, and what can I teach you? Be present in
the community.
Yeah.
Actually be there.
Yeah, and that doesn't necessarily mean that I want all the churches to go to the downtown east side and sign up for Insight. It means in your own communities, even as Calgary is doing a housing first model, people are getting housed in these communities who have been homeless for many, many years, in communities all over the city, not just downtown. So churches have an opportunity right now to really reach out into their communities, get to know their neighbors, not as formerly homeless people, not as like an outreach, but just as being present in their own neighborhoods. And that, I think, so much good will come of that when that happens.
You mentioned being Dopesick. When I was a drug addict, and I was a very serious drug addict, I was lucky. I had when I was a kid, I had allergies, so I was scared of needles. So I never became an IV drug user. However, I was a very serious drug user, both of methamphetamine and crack, and I was a garbage head. And I would get Dopesick, ephedrine poisoning. It was not anything nice. And I would explain it like this because people, when I was panhandling, yes, I might have used that money for drugs, but those drugs saved my life because I was Dopesick, and if I went back to the park Dopesick, I was vulnerable. And if I was vulnerable, I would have been mugged, or worse, or I could have died. So, it's hard to explain Dopesick to anybody that's not been around drugs, and hopefully you'll never have to be. But I'll segue that to, many people don't have a reference point because they've never been on Skid Row. They've never seen somebody overdose. They've never experienced the really dark side, the hell of society, really what it is. And so if you walk into a place like Insight and you've never experienced anything like that, yeah, it's a shock. I work with homeless people for years, and I'm always around drug addicts, and it was a shock to me. But what I gotta say is that you have to have an open mind. You really have to have an open mind, and you just look at the statistics. To me, it was my heart that guided me and said, oh my gosh, this is saving lives. But then, you have to also look at the numbers, and the numbers are just amazing. But as I said in the other interview I did, I also agree for abstinent places. People are so different. You know what I mean? I'm not just saying that every place should be like Insight and allow drugs. Some places should be drug free, because some people are going to find their recovery in different, you know what I mean? So it's not one or the other. It's that we all have to work together. And there's certain things that the harm reduction model supplies or offers that the abstinent model doesn't. The abstinent model is pretty much sometimes very ignorant. If you're not sober, you can't come in here. I mean, in Los Angeles, there's several organizations when I was homeless that said you had to have 7 days sober before you came in. And I was like, I can't keep sober 7 minutes. How can I get a week before you'll help me? Can you help me get sober? So that's, you know what I mean?
Totally. And I think one way to look at it is it's sort of a ladder, right? And insight is that first step. So it's for people who can't even fathom that next step of being sober 7 days or doing whatever it takes to even get into treatment. That's a huge life decision for some people. I mean, I've seen 3 generations of the same family shoot up in the same room.
Wow.
So for that to happen, those generations, those upcoming generations and the younger ones, for them to consider a life of treatment and just what we would consider a normal life, that's not normal for them.
Right.
So reaching people in that moment, building relationships, that is the key to insight, is relationships.
You mentioned some research. Where is it? Can it be found online?
Yeah, so if you go to the Insight website, the VCH website, there's tons of research available there. The most recent research report was published in the Lancet, and so you can look it up there.
What's a Lancet?
It's a medical journal, yeah. But there's tons. There's the Canadian Medical Association Journal, British Medical Journal, like all of them have articles on Insight.
So anyways, thank you very much.
Yeah.
Thank you. I mean, coming from the angle, basically you mirror me, except that you're much better looking.
Oh, geez.
And you're nicer and you're educated. You know what I mean? You come from the healthcare. You come from the healthcare. So thank you for taking time off your afternoon.
Thank you so much.